Good morning, guys. So I'm shooting this video. This video is about back pain. And if you're looking for a video that gives you a quick 30-second fix on what to do, skip, because this isn't for you. This is for, what is this for? This is for, I guess, all those YouTube videos that we see out there where you got someone who's perfectly healthy, talking about how you can get rid of your back pain. And I am a therapist, and no one is immune to the potential for irritating the body at some point. We can protect ourselves to the degree we can protect ourselves. I am a highly protected because of the work I've done, and I have fallen and fell to it. So I'm not going to go through the story of how I've arrived at here. Let's just say it's happened and transitioned over quite a few days. And it was yesterday where it's been painful. Tuesday, Wednesday, like sitting was becoming painful, but I could get on. There was movement, but it was yesterday where the back went into what we would call a true spasm, where it's just locked up and it's gone, nah, we've had enough. The reasons why, there are always reasons why, and everyone will have their own story. The story is the story, and I don't need to go into it. However, there are a few caveats to this. If you are experiencing numbness in your feet, tingling, like lots of tingling in your feet, or you are getting sciatic, like pain referrals down the legs, that is your key right now to stop the video. Look for someone you can phone up that has knowledge of these such areas. Yes, you can go to your GP, but they are not specialists in this area. I mean, you could have a GP that is more knowledgeable, but it's not a guarantee. If you have a GP like that, fantastic. Otherwise, because they can refer you to areas and stuff, but otherwise, physiotherapist will be a great starting point. If you're having bladder issues, ignore the physio. That's straight to the hospital. Sure, you're fine, but you just get checked out. Okay. So that being said, if you are in a position where you're laying on the floor like I am, then this video is going to guide you through, and I'm going to shoot this every day to show where I'm up to on my process and what I am doing, not only to help myself recover, but chase this out of the system. So you can see it firsthand from a therapist who is not just giving you advice, which is absolutely wonderful, but is actually experiencing it as they're going through the advice procedure, which is different because you have the emotional complex to it. There are lots of layers to this that you will be experiencing yourself that sometimes get missed because a person isn't experiencing it. So yesterday, I can't now film in hindsight, so I can't film it, so I'm going to have to talk to you in hindsight. So what did I do? Well, yesterday when the body went into spasm, not everyone's different, but it raised quite a bit of fear, because I have prior to had back pain. I had a very interesting bout of back pain. It's like 15 years, around about 15, 14, 13 years ago, that was quite significant. So there is a memory trace within me of that instant, and that energy, that fear rose up within me, like, oh my God, what have I done? Oh, I had a sore back, and then you went running on a sore back that you knew was slightly sore, like that. So all these questions come up, you start doubting, oh, am I safe? That's the bottom line. And this is the first thing you need to work with. Your alarm system will be going off, going, oh my God, what have I done? Am I going to be able to work again? Am I okay? Am I ever going to get better? Is this going to knock me off my job for a month? Am I going to have to quit my job because I'm not going to be able to do these things? These are examples. I'm not saying these are what I'm thinking. And an endless list of thoughts that come in. The first thing you need to do is work with that. That is the emotional rising. That is the fear response that your body's having. Why? Because your brain is geared up for safety and survival. So it's looking for any threat to your safety. So it is scanning for safety. The problem with that is it can actually make the scenario worse because your body goes into a greater bracing pattern due to the very fact that you are having the experience of pain that you are having, accompanied by the thoughts, and it loops. So the first thing to do is find a position of comfort. For some people, that comfort will be, oh, I can't feel anything. For some people, it would be a 3 out of 10, but that's as good as I can get. Whatever it is, that's your position of comfort. And the first thing you need to do is have that communication with yourself. Now, I am summing this up in a moment. There is a whole load to this, and I've worked on this stuff with myself in hell. But the bottom line is I am safe. Everything is okay. And from the point of view of my body is going to get better. Your body, you must remember, your body is designed to heal itself. Our body functions on evolutionary and survival principles. There is no evolutionary advantage whatsoever for your body to maintain a bad back, because if it did, you're not going to be able to go and hunt, is what the body would work, because we've evolved from hunter-gatherers. So your body, you're not going to be able to go out and hunt, so you would die, and you're not going to be able to fight invaders or deal with predators, because you're going to die in those scenarios. So in either of those two scenarios from evolution, which no longer we have to worry about, but that's how our body comes from, in either two of those scenarios, there is no evolutionary benefit, survival benefit whatsoever from your bad back not healing. So I use the expression, so your body wouldn't map for it. So it won't. So you have to start to calm your nervous system down. We're going, this will heal. We are okay. We are safe. And when that mind comes in, one of the best tricks, simple tricks you can do, is when you hear that doubt coming in, you catch it. What on earth does catch it mean? It means you hear the thought in your own head. Now, that's a whole ball game for some people, for the vast majority of people. But you can hear that voice in your head going, or the thoughts going, oh my God, am I okay? You wouldn't put those thoughts, I'm not going to go into that. That's a whole other side of stuff. So you hear that voice and you say, brain, or whatever, brain, I hear you, but we're safe. You don't need to communicate this anymore, or anything like that. Brain, we're safe. We're okay. We've got this. We're fine. Body is healing. It's doing its thing. It's just going to do it in the time it takes to do it, and we're okay. So you're kind of giving yourself inner permission to have faith in the process. That will start to help the nervous system calm down. Why is that so important? Because if the nervous system, let me just adjust. Oh yeah, this is fun. Actually, you can go into this position. If the nervous system is jacked up on fear drives muscle tension, bottom line. So then anytime you have that, you work with that and you allow that to just be, you allow that, okay, this is where we are safe. Okay, so then on day one, you're in this kind of like, from a temperature point of view, you're in this ice heat scenario. However, you can get it quite wrong with ice when it's not required. So did I actually ice yesterday? No, my intuition on where it was I didn't ice. I didn't have, because my scenario had been irritated for a few days into it, and then the spasm came. That was not a situation where I was going to use ice. If I had a sudden injury, then ice would be appropriate to keep the swelling out. So for me, yesterday, I was actually applying heat, and my intuition said heat was right. And when I put it on my body was like, yeah, we kind of feel like that's what we need. This muscle is needing to release. So that's what I did. I used heat in a hot water bottle, not directly on the skin, obviously, and I held it on there for 15 minutes, there or thereabouts, moving it around a little bit on the back, see the side of the spine of the lower back, and then I allowed the body to just settle down in that way. Doesn't clear it up. It's just helping to keep things as loose as possible. And as you're probably knowing, laying there, that loose ain't very loose at all, and it's probably quite tight. You don't lay there all day. 30 minutes tops if you're in a laying position. You need to get some movement in, and that movement, for me, I was able to walk. I was fortunate. I've had it before where you can't even get to upright. So you've got to keep mobility within the body, but very lightly, and I mean very lightly. which is pretty much what I did yesterday. When I was sleeping, I tucked the pillow in between my legs and lay on my side. If I was laying on my back, I'd have the pillow underneath my knees, but I didn't. I was laying on my side, and that's how I slept, and I was able to sleep. I don't really ever take medication at all, but I popped a couple of paracetamol just to be sure that my sleep would be as high quality as it is. But I don't often take the medication unless it's needed, so that I'm fully aware of what's going on. So I'm not saying don't take paracetamol. Sleep is huge, which brings us to that sleep element. The importance of the sleep to help the recovery process is massive. So what I'm saying is this: your sleep might be disrupted, so you get what you get in the initial phases, and that is just a pill we have to swallow. However, if getting sleep is not an issue, yet you are staying up whilst you're in this current situation till midnight because it's like, well, I'm doing nothing, I'm just going to lay here and watch a film. That's not intelligent. You need to give your body the respect. You got to be in bed. We usually say 10:30. With about 9:30, trying to get to sleep without trying, because when you try to get to sleep, you rarely fall asleep. So that's the thinking, that's the sleep. I'm going through these elements. That's the movement. It's just gentle movement. Can I walk gently? I'm not going in stretching. I'm doing some, maybe, some back arches very gently, like happy cat, angry cat, but really first aid now. I'm staying away from most of these things. It's just about getting the blood moving a little bit. So where have I been? I've been sleep, movement, thinking, hydration, drink lots of water, good high quality water, Evian or something. If you've got to drink tap water, but just you want the highest quality water and you want to be drinking a good amount of water. Remember, the mathematical equation for the good amount of water is your body weight in kgs multiplied by 0.033 will give you your litres per day. And add a little bit to that. Nutrition. You need to keep eating throughout the day. Processed food, inflammatory food, so sugar. You just get away from the sugars. Don't drink sugary drinks. Oh my gosh. Like, if you want to slow down the process, tell you what, if you want to make your back take as long as you want, have lots of sugar and have processed food and fill your boots with that, and just that will impact the back in ways I'm not even going to go into. If you can get away from gluten, get away from gluten. For most people, gluten is an inflammatory. If you can get away from dairy, get away from dairy, because for a lot of people it's an inflammatory, unless you have no issues with those foods whatsoever. And then eat at your regular intervals. If you can, increase your level of protein at this point. If you had a high-grade collagen supplement, fantastic. Pour some of that into a warm drink. And that will go a long way to giving your body the nutrients it needs to do the repair work that it needs to do within the body. And then the last one, which is really important, because these 6 is your breathing mechanics. How in the hell is my breathing mechanics going to affect my back? We're already up to 13 minutes. It just does. We're going to that. Look at some of my other videos. So I want you to lay in that position of comfort. It can be on your back, fantastic. If it's on your side, it's on your side. And you I'm not moving. I put my hand, I'd leave the thumb pointing up, just over my belly button. And this is the breathing mechanics. If you can just see this hand. Hopefully you saw the thumb move. If you didn't. The point is, as I breathe in, I send the breath not to my chest, not to the bottom of my ribs, but down to my belly button. So I actually feel my belly distending, moving out as I breathe in, and it's gentle. And then the last third, so the first 2/3 go down, and then we feel the last third. So it's kind of like a wave. Feel, and wave to feel the final bit. Have a nice easy breath. And out. And just do, a few minutes. And let's give specifics for those people who work in specifics. do 3 minutes of belly breathing. You can do that every half hour, nice and easy. There are a lot of positive benefits for that I'm not going to go into right now that will help the scenario. So there you got those 6 things that you can work on whilst you're in this position. That was the movement, the breathing, the thinking, the sleeping, the drinking, eating. And that brought me through to the end of what was day 1. I am going to talk about day 2 in a hell right now, so this video is going to be long. Day 2, we are on day 2. We are, what is the time? It's like 9 in the morning. Let's have a look. Phone reveal. Yes, 9:30 a.m. in the morning of day 2, of what I will call day 2. So what have I done? I've made sure that I've wrapped up, that I'm warm, that I'm keeping heat within the body. And I've already done some gentle mobilization exercises. So what did I do? In these positions, I just did gentle stretching, and I mean light. This is a lower back issue that I've got, lower to mid. It's the quadratus laburnum. So I've done gentle stretching of this and other areas, because other areas will impact. Now, I know for a fact that my hamstrings, and for a lot of people, the hamstrings are a key player in this one. It can be other muscles. So I've done some very light hamstring stretches in a position that enables me to stretch the hamstring without irritating the back. So you can be, I was actually sat up and it was okay to do that. You can put your foot on the wall, you can do more, you can have a partner assist you into a stretch. But one of the main things you've got to consider is making sure your lower back just stays in that nice neutral position. So you don't want to be rounding off your back to complete the stretch. So if you're laying on the floor, you put a towel opposite your belly button. And if you can have someone gently lift the leg and just raise it till you feel the start of a stretch, then that's great. We are not doing Olympic athlete stretching right now, nor are we stretching to get ready for sports performance. You're doing a nice, easy stretch, and I'm holding it for 15 to 20 seconds at this stage, real light. And that's what I'll do throughout the day. I do feel like I could go for a longer and deeper stretch. I'm not going to. Wherever I feel that tension point is where I'm going to, and then I'm just going to hold on that, and I'm going to come away from it and repeat a couple of times, and then I'm going to move to a different body part. But what I am going to do is get my spine moving where I can. And again, and I'm going to demonstrate this one to you now. Let's move into position. So in this position, I'm going up on fists. Allow my back to arch. My head goes up, and I breathe in on that one, and I'm going to breathe out. Now I feel like I could go further, but I'm not going to. I can feel just the edge of the stretch. And I will spend a minute just doing this. Just getting the body to move. You might not be able to move far at all, and if actually this aggravates, you probably need to wait till tomorrow. Always trusting, knowing that my body is taking care of itself. And now I'm using intuition. Can I sit back into this? Yes, I can. Yes, I can get into this position. I can feel a stretch on the lower back. But one thing I have noticed, and I'm going to show you now, and you see I'm moving gingerly, if I go onto my front. So when I tried this half hour ago, my body didn't like it. Already just laying in this flat position, and sorry you can't see me talking to you, but laying in this flat position, I can feel tension around the lower back. I've got nothing going down the legs whatsoever. What I am going to try is just put my forearms, let me move back so you can see, and this must be done with control, put my forearms underneath. There, that's enough. Literally rest my head. I can't, so I just have to go there. And I'm just going to hold this position so I can feel tension in my lower back in this position. I mean, tension is just there. But this is what it's about. It's about gently integrating movement within the body to enable you to start to get your foothold in where lower back pain is concerned. So with me, now I'm going to show you, I'm going to bring myself up onto my side, bring my leg under. Now, when I'm getting up, I'm activating my core. Other videos will show you how to activate your core, but I'm drawing my transverse abdominis in to protect the area. Moving forward. There we go. And now I'm going to take myself up to my feet. And I'm in a position where I can stand upright. And what you have to appreciate is I am prehabilitated, which means coming into this back pain, I'm coming from a position where body is my job. I've done a lot of prehabilitation exercises so that my body has the greatest chance of the quickest recovery. So a lot of people, you will be like, I can't get up past here. We might be kinked to a side, and you're having to work within the parameters of that. Move around, even if it's 30 seconds, back down you go if that's where you're at. And this brings me to the other point. You need to make sure you are, you get this back pain, a squirrel just flew by. Hello, buddy. Notice things, notice nature, don't go in on yourself as well. Notice other things, it's really important. Where was I? So it's really important that you understand what I mean by prehabilitated for when you are out of this scenario, because you will get out of this situation. This is not a lifelong situation if you just follow the basics of listening to your body and working through it. If your case is more complex and it is like it doesn't resolve, do not worry. There are trained professionals out there who can help you. I highly recommend a Czech practitioner because these guys really know their stuff. If not a Czech practitioner, you've got to use your intuition on a potential referral from a friend that says, yeah, this physiotherapist is really good, or that's kind of the advice I would give with this, is going down that physio kind of route if you're not going to see a Czech practitioner. Because the great thing about Czech practitioner is they are integrated health professional. They will work with you on all the aspects that may be the reason why you were vulnerable to this in the first place, and they will refer you out where they need to and communicate and liaise with the physiotherapist for you to then be, once you've worked on the bits you need to, or a chiropractor, rarely, but a chiropractor, they work on the bits they need to, and then it's kind of like we're integrating this team to support you if you require that. But hopefully, and in the highest probability, for most people, they're not in that situation and they can move through this quite swiftly. So the prehabilitation, God, I'm waffling now, don't care, it's gonna be a long video. The prehabilitation part of this is that you do the work when you're not injured. So when you get out of this situation, don't just go, oh great, I'm out of this situation, and revert back to normal. Find yourself a Czech practitioner or a good therapist, a Czech practitioner. I wouldn't say just go to a personal trainer. Sorry, personal trainers are fantastic, and there may be a fantastic one, but I wouldn't say just go to a personal trainer for a strength and conditioning program. You need an in-depth, thorough evaluation and assessment of your body, so that we know the entry point for every single exercise for that. If you have a PT who is a qualified Czech practitioner, you're laughing. So what you will then do is you're doing all of the stabilization work to prehabilitate, i.e. get your body to the strongest possible point or stability point, so that if you were to re-injure, because no one's immune, point in case, if you were to re-injure, then your body is already prehabbed, so the recovery is quicker. And then when the pain goes and you need to get back into training, the training just accelerates through much better, and you end up in a much better position. So that is where I'm at to the end of day 2. So what will I do now for the rest of the day on day 2? I'll continue doing what I've just done this morning and from yesterday. All those 6 foundation principles of the thinking, the breathing, all those I'm going to be doing throughout the day, which is why I'm about to go get food. I've just drunk water this morning, building up my water, and going to get some food, good protein. And move position. As you know, you need to do this quite a lot. And then I will carry on with light stretching, see how the day goes. if my body opens up, when my body opens up. Do you see how that nearly caught me? If? No, there's no if. When my body starts to open up better, that is how subtle the thinking is. And your subconscious hears you say if. Or if I am better later, if it starts to feel better later. What? Am I trying to get better or not? What a load of shit. If it gets better, then I will, there it is again. Beautiful. Oh, it's so subtle. When this gets better later, when this starts to feel better later, I will then increase the reach into the stretches to enable my body to just get those gains that it's going to get from the body opening more, and then me asking it to do a little bit more gradually. Heat will also be my friend today. Anything else? No, but we'll it probably will be, but that could be on the next video. So I will be shooting this video. I might shoot another one tonight, but probably tomorrow, and we'll see how we're going, and yeah, see what you make of it. Anyway, guys, cheers. Think about those 6 principles. You have got this. You will be fine. All is good. It's just going to take a minute. All right, take care.